You're listening to CJNU 93.7 FM. I'm Adam Glynn, and joining me in the studio, Dr. Paul Galbraith. Paul, it is a real pleasure to get a chance to sit down with you.
Thank you very much.
Are you a lifelong Winnipegger?
I have lived in Winnipeg since I was born, with two exceptions. I was educated in Winnipeg. I went to Kelvin High School, and then I went to the University of Manitoba, both pre-med and to the Faculty of Medicine. After I finished my medicine, I interned at the Winnipeg General Hospital and spent time at a year as resident at Deer Lodge Hospital at the time. And after that, I went for 2 years to the University of Utah in Salt Lake City. I greatly enjoyed my time there. And I came back to Winnipeg in 1961, and I took up practice at the Manitoba Clinic in Winnipeg. And unfortunately, what happened was that I was not receiving the kind of patient that I had been trained to treat in the University of Utah at Salt Lake City. So I then went to Baylor University, which a portion of which was at that time still in Dallas, Texas. I was at the Baylor University Medical Center, and I was an assistant professor of clinical pathology. What that did was it reinforced the knowledge that I had about blood diseases, and not really being taken with Texas as the place to reside, I came back to Winnipeg. And what I did in Winnipeg that really helped me was I set up the laboratory at the Manitoba Clinic, which I then ran for 41 years. And doctors said, well, if the guy can really diagnose it, maybe he knows how to treat it. And so finally, we started receiving the kind of patient that I had been trained to treat in the first place. So that was really a great step forward.
What was it that inspired you to get involved in medicine?
As a child, at the age of 3, I wound up in the Children's Hospital, and the great pediatrician of the time, Dr. Gordon Chown, said this child has either got tuberculous peritonitis or celiac disease. Well, fortunately for me, it was the latter. And, quote, you'll grow out of it, which was the case. In those days, they didn't understand the role of gluten. But I was so impressed with medicine at the age of 6, I decided I would like to be a doctor. And from that time onwards, that was my goal in life.
Did you find that it affected you a lot as a child?
Yes, it did. It delayed my maturation considerably. And at the age of, I guess it would be about 17, I was in Kelvin High School. And the first time I went from a small school to Kelvin High School, I was really under a lot of stress. And wisely, my parents took me out of Kelvin High School at the Christmas time, and that year enabled me to mature sufficiently so that when I went back the next year, I excelled in grade 10 and 11, and I was headed on to university after that. So that was a good thing. But celiac disease definitely delayed my maturation.
With that in mind, was high school an interesting time for you?
Yes, I enjoyed high school. I participated in the operettas that the school put on each year. And I was never very good in sports, so that was my main side event at Kelvin.
Excellent. We're going to come back to that later because I'm sure that maybe has influenced your taste in music. But so obviously you went through your high school career, you were on the path, you knew you wanted to go into medicine. Going to university, what was that experience like?
Well, I enjoyed the University of Manitoba. In those days, I went to the University of Manitoba, which was at the corner of Broadway and Osborne. And I would even ride my bicycle to the university. Or when the winter came along, I went to university on children's car tickets. In those days, they were 8 for a quarter, and I looked so young that they never questioned my going to university on children's car tickets.
Bargain.
At any rate, I had to take 3 years of pre-medicine because they'd increased it when I was, before I got into pre-med. And so that led me to have an extra year at Broadway. And I went from Broadway to the University of Manitoba, And then after that, I went to the medical school for 5 years.
And the rest, as they say, is history.
Yes.
Well, you mentioned already that you started your career and then found yourself not quite seeing the type of patient that you were hoping to. What was it that you specialized in, and what was it that you really wanted to be doing, even at that stage in your career?
Well, I was very fortunate that I was educated at a time when the management of cancer was just starting to improve. And I was very interested in blood diseases because of something that developed at Deer Lodge Hospital. And I enjoyed both doing the laboratory work and the clinical work in that subset of patients.
It's interesting that you mentioned that, because I think some people in the medical profession, obviously it's an incredibly broad umbrella, but some people are incredibly good when it comes to the front-facing work and dealing with people. And some people are considerably better at dealing with the research and the hard science and the graft and the study and everything else. But it sounds like you always were interested in doing both.
I was not really involved in research. I did write a number of papers, but I was not really involved in research. I was fortunate in my day as a medical student to work under the tutelage of Dr. Donald Penner in pathology, and I had a great advance there. I got my BSc in medicine with Dr. Penner. And then after I graduated, I took a year at the university with Dr. William Perry and Dr. Robert Beamish. And I did work on heparin and its effects on fats in the blood. I realized at that time that I did not have the imagination that you need to have to be a good researcher. And so I always wanted to be a doctor, which I pursued, but not in the research area.
Absolutely. Well, it sounds silly to say, but some people clearly have the bedside manner, whereas others do not. And I think it's fair to say, in chatting with you here, you're a people person.
I enjoyed doing what I did greatly, and I tried to help those who came to me as much as I could.
That's really fabulous. If folks have just tuned in, welcome. You're listening to CJNU. I'm Adam Glynn in conversation with Dr. Paul Galbraith. Paul, what was your family life like as a child growing up? Were your parents excited for you to be going into medicine?
My mother was a university graduate and a school teacher in the city of Winnipeg before she married. And she encouraged me to get as much education as possible. My father was a businessman who ran a coal and ice business in Winnipeg and a highway construction firm in the summertime. And he recognized that his son was probably not a good businessman and therefore should go on to do something else.
Well, it's heartening to hear that you had the support, though. They were keen for you to do well.
They were very supportive.
So you found your career on this interesting trajectory and you decided to further your studies. You mentioned you went down to Salt Lake City. I can only imagine that was a very different experience to studying in Manitoba.
Salt Lake City is a wonderful place. I greatly enjoyed my time down there. I had completed 3 years of postgraduate work in Winnipeg, and fortunately, Dr. Lionel Israels referred me to Salt Lake City, where I came under the tutelage of Dr. Max Wintrobe, a former Winnipegger. And in Salt Lake City, we saw patients who came from all over the world to see the man who wrote the book on blood diseases. And we would examine these patients, do certain amounts of lab work on them, and then we would discuss them on Tuesdays and Fridays at a conference in the morning, after which the professor would see the patient and tell them what they wanted to know or needed to know. And that was a great experience for me.
That's a really interesting and sort of collegial approach to medicine. You know, I would assume that at the time, that kind of approach wasn't the standard.
It wasn't. There were, Dr. Wintrobe had 4 fellows with him at that time that I was there. After 6 months being there, the senior fellow decided to go to California and go into practice. And so I became the senior fellow with the group there. And it was my responsibility on Tuesdays and Fridays to assign the new patients to the other 3 fellows. And they came from a very impressive background at Harvard and universities in New York State that enabled me to see that in Manitoba, I had had just as good an education as these people had had, even though they had lectures from the people who wrote the books.
Now, that is a wonderful thing to hear, even, back then. People, I think, underestimate how good Manitoba and Winnipeg can be. Quality of education here is amazing. The quality of life here is amazing. And of course, as we get on to talking about your career and passion for the Health Sciences Centre, the quality of care that is provided here is world class.
It is. The Health Science Centre is a world-class facility. And we often don't think of it in that capacity, but Manitobans are very fortunate in having that facility here. We receive good people from other parts of the world, and we send some of our excellent people to the University of Toronto, Montreal, Harvard, California. We are very fortunate. We're blessed here with that facility.
I think sometimes people don't know how good you have something until you go away and come back again. Did you find that, having studied elsewhere and then come back to work at home?
Absolutely. And we certainly have that kind of facility. I was always pleased to come back to Winnipeg.
So you spent the majority of your career at HSC?
41 years.
That's quite remarkable. So through that time, what kind of things did you find yourself doing? Because I know it wasn't all frontline work.
Well, I got involved with medical administration early in my career and got on various committees at the Health Science Centre and ultimately became the chief of staff of the Health Sciences Centre in medical staff. Later, I was chairman of a committee that dealt with doctors in the other hospitals in Winnipeg. I treated patients all the time, and I greatly enjoyed my teaching of young doctors who came into the medical services, where we spent a month at a time being the chief of the service. And I greatly enjoyed that time.
So as somebody who obviously lived and worked there and had a career there for the majority of your working life, you started doing frontline work, you ended up being in the upper echelons, so to speak. What was it like being able to work a career and see both sides?
Well, I enjoyed both sides. It was, when you're on the board, you sort of have to participate in decisions regarding how the center goes forward. And I was always impressed with Mr. Peter Swarhone, who was the administrator of the Health Science Center during the time that I was there. He was a very dedicated person. And so were the other department heads who excelled in their roles.
Now, you have always been passionate about healthcare. I think it shines through in everything that you have said. And even in latter years since your retirement, that's a passion that you have not let die down.
I retired at the age of 74 in 2004. And I have, until the COVID-19 pandemic came along, participated at ward rounds in the cancer care facility at HSC, and have enjoyed that part because I wanted to keep up. That sort of came to an end when the epidemic came along, and I haven't gone to rounds, but maybe when things improve, I'll go back.
It's nice to have something to look forward to, eh?
Yes.
Absolutely. And it's interesting because I think people do understand that no matter what political stripe happens to be the folks in the pound seat at any time, any government will never have enough money to fund everything that needs to happen in healthcare.
Well, Manitobans can be very proud of their facility called the Health Science Center. It may be in Winnipeg, but Health Sciences Center helps everyone in Manitoba. And therefore, I hope that Manitobans, no matter where they live, will find the resources to support that center. And this is a very good year to do that.
Absolutely.
With the increase in the stock market, some people at least will have within their resources the ability to donate some of their earnings towards the Health Science Center and get a charitable donation. And at the same time, they will be able to avoid the payment of the capital gains tax next year at tax time. So Manitobans, I hope, will join in to this very important task of trying to promote and continue the leadership that Health Sciences Center provides in this province.
Quite right, too. And it's only through the work of organizations like the HSC Foundation that a lot of the world-class research and additional care can happen, because there are only ever so many tax dollars to go around, and every hospital is always doing hard work, but it's individuals who choose to support the HSC Foundation that really make things happen at HSC.
That is correct. The Foundation for a Health Science Center, I don't think, provides financial support for individuals, but what it really does is it provides financial support for new advanced equipment and for new programs which enable us to provide service to needy patients. The magnet that brings doctors back to Winnipeg after being trained elsewhere is the fact that we have those resources at our Health Science Center.
And it was amazing, at the moment that the pandemic began, the HSC Foundation went into top gear and said, all right, what can we do to support patients and care right now? Looking at things like making sure that there were tablet PCs, iPads, these kind of things available, so that if patients couldn't have visits from family and friends, at least they could stay in touch with everyone.
Yes, I don't know what the most recent donations from the foundation are to Health Science Center, but what I do recognize that we are making progress. Just recently, a doctor by the name of Dr. Ryan Zarachansky, who is an oncologist, hematologist in the center, was the leading author of a study which had participants from across the country. And what they discovered was that heparin is beneficial to a subset of patients with the COVID-19 infection. And that study was published in Boston and reported in the New England Journal of Medicine. That indicates the kind of caliber of person that we have in Winnipeg.
It's quite remarkable. It really, really is. Folks, if you've just joined us, welcome. You're listening to CJNU. I'm Adam Glynn, and I'm in conversation with Dr. Paul Galbraith as part of the Bannatyne Legacy Circle celebration for 2021. And Paul, you've always been interested in philanthropy, I think it's fair to say.
Well, I'm not a rich man, but I try to support our church, and I try to support medical facilities. About 25 years ago, I bought a life insurance policy, which I pay on monthly, which has not been yet allocated to various places, but at least 2 of those are going to Health Science Center, and that should help in nursing and the medical staff recognition.
People should always remember you don't have to be wealthy to be a philanthropist. Anybody can donate anything.
You are absolutely right. We can all do our part in donating to needy facilities in our community, and Health Science Center is certainly worthy of their support.
Here at CJNU, we're always very proud to accentuate the positive and work closely with other not-for-profit and charitable organizations in our community. And we like to shine a light on the good things that are happening in our community. And it's always heartening to hear stories like yours and your experiences in working at HSC and seeing the impact that can be had. and even now in latter years, continuing to support the foundation, just in terms of donating time and money. It doesn't have to be $1. It can sometimes be donating your time and your energy that can be just as important.
You're absolutely right.
Now, if folks are interested in learning more, of course, you should check out the wonderful resources that are available online. But the Bannatyne Legacy Circle, it's thinking about long-term giving and long-term support. Clearly, you've already been thinking about the long term because throughout the entirety of your career, you've made contributions to the causes that mean something to you, with HSC being one of those. But now you made that decision to sign up and become a member of the Bannatyne Legacy Circle. Do you feel good having done that?
Yes, I do. And I also am donating to the University of Manitoba in a parallel way to what I give at HSC.
That's amazing. And just to draw a line under that, folks, again, always pick the causes that mean something to you and support them as best you can in any way possible. We are so lucky that Manitoba is a place that's so giving. And I'm going to ask you that, Dr. Galbraith. What is it about this place? There's something about Winnipeg. There's something about Manitoba. I've only been here a decade or so. You've been here most of your life. What do you think it is about this place?
Well, first of all, it was home, and I always thought of it in that context. I have greatly enjoyed my summers at the Lake of the Woods, where I have had a place for 45 years until last year. And we are very blessed in having Lake Winnipeg and the Northwest Ontario resources that we can all tap into. So we have an awful lot to be happy about here, and I wouldn't want to be anywhere else.
That's a really lovely thing to hear someone say. It's always nice to meet somebody who isn't too self-deprecating about Winnipeg. I think we all have the right to be a little self-deprecating, but it's nice to know that people really do love this place.
Well, the winters are cold, but we don't have the typhoons and the floods that you see in Louisiana and the east coast of the continent. So we are very fortunate in that respect.
Absolutely. So it's been home for you, and of course, your family too. Tell me a little bit about your family and how you've enjoyed life together here.
I have two sons and a daughter. My eldest son was born in 1958 in July in Winnipeg, and at 4 months of age, he went into coma and was treated at the Children's Hospital by Dr. Robert McNeil. And what he had was he was born without a thyroid.
Wow.
And so he got cooled down in November, and he was rescued and is now well and happy at, I guess, 63 years of age. He benefited by the Children's Hospital and the resources we had at that time in 1958. My daughter was born when I was in Salt Lake City, and she has always been well, and she now resides in Denver, Colorado. My second son was born in Winnipeg, and he is a doctor and a hematologist, and has been the head of hematology and oncology at BC Cancer in Abbotsford. So he is following in the line of being a doctor, and I don't know what his sons will do. They're both at the threshold of going to university, so we'll see what they do.
Absolutely. It was interesting. I was going to ask you if anybody decided to follow in your footsteps, and I guess one of them saw fit to do so.
Well, I should have mentioned too, my late wife was a nurse, and that must have instilled in my daughter, who lives in Colorado, to be a nurse, which she did become, and then she became a midwife in Denver, Colorado, and she still works with obstetrics in that city.
That's amazing. It's exciting to hear that, Winnipeg is a place where you have had a happy life, career, family, friends, fun. And it's wonderful that you are so positive about this community and so positive about wanting to support the great institutions like HSC. Before we wrap things up here today, earlier you mentioned that while you were in high school, you were interested in dabbling in little operettas and performances and things like that. Do you think that inspired your musical taste at all?
Well, I still like Gilbert and Sullivan.
Absolutely.
And, those were the pieces that we presented in those days at the high school level.
The very model of a modern major general?
Yes.
Don't ask me to sing it. Before we tie a bow on things here and end our conversation today, everyone who's participating in the Bannatyne Legacy Circle celebration here at CJNU gets to pick a piece of music that means something to them. Something that's important, whether it's something that they enjoyed listening to when they were younger, whether it's something that still brings them a great deal of joy today. And Paul, I know you've brought several selections along with you. Let me know about what you brought and why.
Well, here's a very nice piece that I chose when I was thinking about this. Roger and Hammerstein's "Climb Every Mountain" is a beautiful piece. I've also been "O Divine Redeemer" by Gounod from the Redemption is beautiful. And I like Scottish music. I also greatly enjoy opera, and those are my choices.
Those are well, it's nice that that you have your passion even in the musical world. You mentioned to me once upon a time you did play an instrument. Do you ever dabble?
I learned to play the piano, but I was a very poor student and let that talent go by the way and gave my piano to my daughter many years ago.
And well, hopefully she's having some good use and good fun with it now.
I hope so. Interestingly, her son has a great talent and he can play by ear. He doesn't even know what the notes are, but he can play by ear. It astounds me.
Now, I marvel at anybody who's able to do that. But I'll be honest with you, I marvel at you, Dr. Paul Galbraith, because you are a man of knowledge, passion, and dedication. And it has been a real joy and privilege to get to know you a little better and to chat with you here today. So thank you so much for sharing your time with me and with us here at CJNU. But more importantly, thank you for choosing to support the HSC Foundation through the Bannatyne Legacy Circle.
My pleasure.